So thanks for the question.
Okay, and May is asking, do employees from all 150 countries volunteer with this program?
Oh gosh, thanks for the question, and I wish that they did. We have volunteer programs that that go on around the world, perhaps not in all of the 150 countries, but for this particular program, we bring employees to Tanzania, mostly from the United States and from Ireland and Germany, and some we've brought in from Dubai. So thanks for the question.
Okay, and we have a last one here. What is the percentage of participation in all operating countries out of that 75,000 staff? This is from Andronica Mabuya.
Oh, thanks for the question, Andronica. And I must confess that my primary focus and responsibility is around the work in Tanzania, and so I'm not familiar with what percent, but we can find out an answer to that and get back to you later. We have a specialist
That would
to
be
take care of
great.
that.
Great, great. Perhaps in some material we can distribute after the webinar. You can annex that information to, of course, of course. Okay. So, Andrew, would you like to continue introducing Natalia?
I would love to.
Thank you.
And Natalia, yeah, and while you set up the switch the screen, uh,
Okay.
Natalia Lobu is the executive director of our program in Tanzania. She's been with Abbott for, since about 2010 or 2011, and has a really interesting background, having started as a Peace Corps volunteer, and then taken her education in the United States at a master's in public health and also in nursing. And I'll let Natalia speak for herself, but thanks so much.
Thank you.
Thank you. Hi, my name is Natalia Labu. I'm the Executive Director of Abbott Fund Tanzania. That's my picture up there on the screen, and a map of Tanzania and a map of Africa. Tanzania is located in East Africa. We have 8 neighboring countries and the Indian Ocean. It's a beautiful country. It's known for Kilimanjaro Mountain, which people come and climb, for safaris, and for beautiful beaches on the island of Zanzibar. It's a lovely place to visit and to live. Population is almost 50 million, and over 25% of those live in urban areas. With few resources and deteriorating facilities and a stunning shortage of doctors, there are just 3 physicians per every 100,000 people in Tanzania, compared with 245 in the US. The government of Tanzania has long faced enormous barriers to providing health care for its people. And while many challenges remain, through a long-standing novel partnership, things are changing for the better in Tanzania. Today, patients visiting Muhimbili National Hospital and other facilities across the country receive quality care in state-of-the-art settings, and new ideas in healthcare financing are helping ensure the improvements are sustained for generations to come. And we at Abbott Fund and Abbott Fund Tanzania have been very proud to be a partner in these changes. Now, as Andy said, Abbott and Abbott Fund have been working in Tanzania since 2001. And Abbott Fund Tanzania programs are focused in 3 main areas to elevate healthcare in Tanzania. The first is at Muhimbili National Hospital, which is the peak of the public health referral system in Tanzania. The other area is at regional laboratories located in 23 regions across the country, and also through the Abbott Volunteer Program. At Muhimbili National Hospital, there have been several areas of infrastructure support, professional development support, and operational support over the years. In the photo, you see the new outpatient department, which was designed, built, and supported by Abbott Fund Tanzania. Today, the hospital has taken over all operations for the outpatient department, and it's serving people every day at various clinics including the HIV clinic, which used to be in a different location but was pulled into the outpatient department to reduce stigma. The central pathology lab has been renovated, equipment has been donated, and staff are supported to improve operations and to improve the services that they're providing to the hospital. The emergency medicine department was built and doors opened in 2010, and it's since grown, including an emergency medicine residency program which trains doctors to be specialists in Tanzania. Outside of Muhimbili National Hospital, the 23 regional laboratories across the country have all been designed and built by Abbott Fund Tanzania between 2008 and 2011. And they've been supported through the Abbott Volunteer Program, where mentors have come from Abbott to support them and to help train in the laboratories. In the last 5 years, Abbott Fund Tanzania has really focused on looking at each of those areas and each of the project areas and developing financial and professional sustainability. The emergency medicine department and the laboratory were the first areas, and we can say that especially in emergency medicine, we've successfully developed a program where they have been able to raise their own funds internally and take over operations and really become donor independent. Another area that we've looked at is the sustainability of infrastructure. A lot of times people like to give buildings, but without thinking about what's going to happen to those buildings in 5 years, 10 years. And so spending the time and effort to train people on how to maintain those buildings and to really put priorities towards preventive maintenance. Again, this is an area where Abbott volunteers played a key role because they brought in those values and those skills from Abbott, the company, and were able to transfer them here to people on the ground. I just want to highlight some of the amazing results that Abbott Fund Tanzania's programs have had over the past 15 years. There's a lot of great work going on here, so to present just a few short minutes is not fair, but we'd like to get to talking about the actual volunteer program. But if you look at the results on the screen, the outpatient department, which I showed you, that Abbott volunteers supported the building of in 2004 and 2005, today is serving 3 million patients. Has served 3 million patients since 2007. They've upgraded facility, attracts patients, and retains clinicians in public services. So clinicians used to like to go and work at private hospitals around the city rather than to work at the public hospitals. But now that they have better facilities, they're happy to stay there, and the private patients come, which is a source of income for the hospital. The Central Pathology Lab, 9 million tests results have been delivered since 2002. And 2 units are now internationally accredited, and hopefully another 2 in the next year or 2. The Emergency Medicine Department has treated 275,000 critically ill patients since the doors opened in 2010, and that Emergency Medicine Residency Program I mentioned has graduated 24 specialists who are all working in country. The Abbott Mentor Program, 65,000 hours of in-country mentoring have been delivered on laboratory operations, facility maintenance, and IT management. And these have been delivered by over 70 Abbott employees who have each spent a month, and many of them have returned a second time to Tanzania. In our Building Livelihood projects and communities, we have helped provide education and nutrition to over 350 students at Mkinga District's first primary school. We've purchased dairy cows that are producing milk for over 300 vulnerable families. Thank you for letting me share a little bit with you about what's going on in Tanzania. We'll pause for questions now to see if there's anything you want me to expand upon.
Thank you. Thank you very much. Thank you very much, Natalia. Here we have 2 questions. I'm not sure if the screen is black or is any one of you can tell me what are you seeing in the screen right now?
The screen is black.
Oh, I'm sorry. I will make these questions because questions are arriving. Natalia, hi Natalia, says Manu Juneja. Thanks for sharing about your program in Tanzania. I'm wondering, in Tanzania, how many employees are volunteering and what percentage of time do they contribute to volunteering? And are these employees from Tanzania local or do you bring them from outside the country?
Hi, Manu. Thank you for your question. So, John will talk a little bit more about the volunteer program, but the way it has worked is in Tanzania, we only have the Abbott Fund Tanzania office of about 19 staff, and we work every day on the projects here. And approximately 15 volunteers are coming every year from different places in Abbott, the company. So, mostly Ireland, Germany, and the US.
Oh.
The number varies from year to year, but usually they come for 1 month, and this year we're hoping for 15. So we'll see. It depends on whether they can get 1 month off of time from their usual jobs and how much work that we can, how many places that we can find for them in country.
Thank you, Natalia. We have another one here. How long has the mentor program been happening?
Do you want me to take that? I'm glad to.
Sure. Go ahead, Andy.
Sure. We and thanks for the question. We started the mentor program in 2002, and with real basic kind of work in terms of establishing our relationship, and then started as we built clinical laboratories. We brought in employees that would stay for a month or 2 months or longer, and help the building projects. And then in 2012, we started bringing in a high number of mentors that would work in these 23 different projects that we had ongoing throughout the country.
Okay, thank you, Andrew. And we have two more questions here. And Galina from Russia saying, thank you, Natalia and Andrew, very interesting. Thank you, Galina, how are you? I should ask you, if you permit me, Andy and Natalia, we can invite John to talk because some of these questions will be explained perhaps by his speech. What do you think? Natalia, do you want to introduce John, please? Or Andrew, as you wish.
Go ahead, Natalia.
So I'm actually sitting here in Tanzania, right across the table from John Kisiombe. John will tell you a little bit about his background, but he is our director for laboratory programs and has been working in laboratories for many years in Tanzania and is a great host for our mentors. But I'll let him speak a little bit.
Okay.
As you have been informed by my colleague, I'm John Kisiombe, working with the Abbott Fund as the Director of Laboratory Programs. My background is in medical lab technology. Before joining Abbott, I worked in public laboratories in a number of regions in Tanzania for over 37 years. I'm going to share with you on employees' expertise. Way back in 2002, the Minister of Health in Tanzania, in collaboration with CDC country office, carried out an assessment on health service delivery in the country. The results of which, among other things, revealed that laboratories were the weakest link in health service delivery in the country. Notably, there was an acute shortage of trained laboratory staff, the infrastructure of labs was in a bad state, equipment were obsolete, and there was a shortage of essential reagents.
Okay.
So, Monica, can you hear?
Yes, something with the...
In response,
yeah. John.
Through this, a number of development partners came in to support the government in addressing to these needs. Abbott Fund provided support in a number of areas. Abbott experts have provided 65,000 hours in country giving support and training since 2001. The training has been through targeted mentorship according to needs. To address the problem of shortage of staff, Abbott Fund hired 6 laboratory technicians and placed them in regions which had an acute shortage. These employees were later on transitioned or mainstreamed to public employment. On Abbott employees involved in providing mentorship to Tanzania, this has been in the field of engineering, nursing, laboratory science, and technical application specialists depending on the needs at that particular time. On mentor selection, currently mentors are selected among Abbott employees from different sites, either in the US, Ireland, or Germany. The selection process starts with discussions between Abbott Fund management and site managers on availability of laboratory technologists or scientists who can participate on the program based on the required skills at that particular time. This is followed by interviews to the potential candidates, again based on the required skill set or need. Successful candidates would be picked and timelines for the mentorship would then be determined based on both availability and the respective site readiness to receive mentors. The selected mentors are then taken through a thorough orientation basing on the fact that most of them, this would be their first time in Africa. The orientation normally focuses on the following areas: background information on Abbott Fund projects in the country, security measures during their entire stay in the country, health-related issues including vaccinations prior to traveling to Africa, travel arrangements to up-country working stations during mentors placement and pickup after completion. In some far-to-reach areas or regions, traveling can take up to 2 days by road using Abbott Fund vehicles which are driven by company drivers who have proven to be very capable and well trained. On-site support. During the mentorship period, mentors are given adequate support to make them feel comfortable to fulfill their responsibilities. All issues related to immigration regulations, including visa processes, are taken care of by the Abbott Fund management. Other support activities include identification of suitable and safe hotels, including restaurants. Costs for accommodation and meals are taken care of by Abbott Fund management for the entire time of the mentorship. All mentors are provided with handsets and enough airtime to enable them to communicate among themselves and their families back home. They are also provided with safety gears like laboratory coats, first aid kits, etc. Arrangements are also made for supportive supervision, which is normally carried out by a senior Abbott Fund staff. This is aimed to solve emerging issues, including assessing on the mentorship. The impact of this mentorship has been very huge and significant. And this can be noted by management and other stakeholders, including patients, who can clearly see the improvement in the service provided. Further to that, laboratory technologists become more confident in whatever they are doing, and the increase in knowledge base through appreciation of experts' advice from these mentors. Thank you very much. That's all I have.
Thank you so much, John. Thank you so much. Very interesting. And perhaps one of the, I'm sorry. One of the questions of May, which was how are the volunteers selected, you have explained. And then Undral Gombodor asks you, you all, that he saw that there was 3 physicians per 100,000 inhabitants, and he is asking about how many, if you have noticed an increase in that, or if that is an actual nowadays number, Or now how many? What's the standard number of physician per population nowadays, is his question. Can
Go
anyone?
ahead, Natalia.
Yeah.
Yeah. Thanks, Andre. The number is current. It's from the World Bank in the past 3 years. The 3 out of 100,000. The World Bank also has an average of 75 per 100,000 for lower middle income countries. So Tanzania is really on the lower end with the deficit in physicians.
Oh, okay. And we have another question from Andronica. Partnering with governments is always a complex and challenging environment. Can you share some of challenges encountered?
Andronica, thanks for that insightful question. And I've actually done presentations on the partnership between Abbott Fund and the government of Tanzania. It's been challenging over the years. When we first started working in Tanzania in 2001, 2002, there was a challenge for the government to trust that Abbott Fund was there to help improve health services and not sell products. So we've maintained a strict separation in our foundation work and our giving so that the government knows we're there to help. And we've worked side by side with them over the years. And that's one of the things we're most proud of. Thank you.
Thank you. And now, please, Andrew, do you want to present or introduce our volunteer, your volunteer, Marina?
I would love to. So you all everyone has heard the story about first our relationship with the government, the work that Abbott Fund does in Tanzania. We've heard from John, who administers the program, and now we'd like for you to hear from Marina Yeselevich, who is a scientist working for Abbott, and she'll explain to you a little bit of her background and really what it's meant to her having come to Tanzania and lived for a period of time and shared her skills. Marina?
Yeah, thank you so much, Andy. Thanks for that introduction, and thank you, everyone. So my name is Marina Yeselevich. In the picture, I'm the one on the left. My job is within Abbott. I'm a lead core lab specialist, and I work in the diagnostic division. I live in the United States, in Chicago more specifically. My background is mechanical engineering, and I have been focusing on laboratory automation for the past just about 8 years. My counterparts and myself, what we do is we install and we verify and we repair the equipment that's in the laboratory, which, as Andy had said previously, what it does is it performs the various testing that's ordered by the physicians to it takes the patient blood and it provides results for the doctors so that they can diagnose and treat their patients in the best possible manner. In 2013, I was fortunate enough to be invited by Abbott Fund to travel to Tanzania to install the brand new machines and to make sure that all of the 6 machines that we were installing performed perfectly. While I was on site, I got the opportunity to meet some of the local engineers, and we worked together to install these machines. We learned from each other. We all worked together to get the equipment working optimally. Once I was finished with doing my share of the installs, a person, which is a technical application specialist, came in behind me, and she performed all the various studies on the equipment and provided the proper documentation to guarantee that the results that we were generating were accurate and acceptable. And once all of her studies were completed, the machines were operational and live. In 2014, I returned again, and that was to perform the preventative maintenance on the equipment. I worked again with the same local engineers and showed them some best practices that we had developed over the past few years to optimize their equipment and to make sure that it continues proper operations for years to come and provides valid and good results for the doctors. I was also very fortunate to work with some of the local biomedical engineering students. One of them is pictured next to me, just to train them, to show them what biomedical engineering is in the field, in the real world. When I came back from my first year in Tanzania, it had definitely changed my life. The interactions that I had had with the people of Tanzania and the experience that I had inspired me to do more. I decided to go back to school and to pursue a dual master's, the first one in public health and the second in business administration. In order to complete my public health master's, I was given the opportunity to do a project which involved interviewing past mentors and their managers about their experience in Tanzania. What I learned was kind of incredible. What I learned that everyone who went was changed when they came back. They were all so grateful for what we had, and they were so grateful for the company that we work for and for the job that we are doing in Tanzania. And every person that I had spoken to, and all of their managers had agreed to this, that they had developed a stronger sense of loyalty and pride to Abbott for doing the projects that they're doing and for providing the resources in order to advance healthcare. Every manager and person I spoke with spoke in depth on the importance of this global corporate citizenship and the necessity of it, not only for the world as one place, but for every single employee within Abbott. So that's that's the entire presentation. If anybody has any questions for me or for anybody else, please feel free.
Thank you. Thank you very much, Marina. Yes, we have some questions written down here. First of all, Makeup is asking, why was Tanzania selected for this work?
I'll be glad to answer that, and thanks for the question. When Abbott was combined with that company I shared earlier called AbbVie, back around 1999, we set out to have a mission to help countries impacted by HIV and AIDS. So we started programs, a small program in Mexico, one in West Africa in Burkina Faso, in East Africa in Tanzania, in Romania actually in Constanta, and also in India. And when we got to Tanzania, we found the government really helpful to work with, and we went there because of their HIV burden, but switched our work from HIV and AIDS to building health systems like you've seen before. So thank you.
Thank you, Andrew. And here we have another comment and question from Manu Juneja. Thanks for this fantastic overview, Andrew, Natalia, and John. It sounds like your program offers capacity building for locals and thus helps communities hugely. Congrats. Can you tell us about the benefit that Abbott hopes to gain in return from a shared value perspective, whether it is employee development or any other?
Manu, thanks for that question, and I think maybe the question came in before we heard Marina share her story, and the first clear answer is employee development and company pride. The people that come to Tanzania and live and work and share their skills always return to their jobs changed. Many of them have been promoted, and they all become really good ambassadors for our company. In terms of shared value, there's a clear separation in Tanzania between any business interest that Abbott might have and the work of our philanthropy. So there's no real specific shared value it's more sharing of our resources and people. We do have different programs, for example, in India that are more focused on shared value, but not so much in Tanzania. Thank you.
Thank you very much. And Undral has asked about where can he find information on standards for health sector, and our panelists have sent a link. I will copy down there after this, but it is http / data.worldbank.org/indicators. Please correct me if I didn't say okay, Natalia. Another question here is, it was great, it's a comment. It was great to hear about the impact in the community as well as the impact on Marina and other employee volunteers. Abbott is fabulous. Thanks. May, you have won the award, the prize for asking the most quantity of, I'm sorry, wait a minute. I will open your, you are on mute, May. Please say hello to everybody.
Hi, can you hear me?
Yes, we can. It's a great pleasure to have you here, so active. How are you?
I'm fine, but I was so impressed with the presentation and just appreciate all that Abbott is doing, and I love the examples of the impact it's had in Tanzania, but also Marina's story of what it's meant for her, and as she reflects on the company. So
great.
I just think it's terrific. So thank you all.
Tell us, where are you working?
Oh. Thanks, Monica. My name is May Cobb, and I lead the volunteer and employee engagement for United Way Worldwide. And Abbott is a partner of ours, certainly, but I did not know much about this work, so this has been very informative and just helpful to learn.
Thank you. Thank you very, very much. So, thank you for all our speakers, and we have some great minutes to share here with all another questions. You know what? If you want to have your microphone open, you press a button in your screen with a little hand. That means hands up. I can see that and can open the microphones for you if you want to. I'm sorry. Oops. Well, now I'm trying to see the little hands. Any other questions? Lori, do you want to comment something? I have all the questions answered, the written questions, and I have no askings for. Yes,
Excuse me, Monica.
Yes.
This is Natalia.
Oh,
I see a question from Estelle Roth, and I'm not sure we answered it fully. I was just going to
please do that.
To add that so as volunteers, the question is, how do you maintain business continuity while volunteers are on the ground? And how do you convince management to free them up for a full month? And how does HR support you in the process? So just on those few questions, it's been a process, and over the years, the volunteer program has gained momentum. In the beginning, it did take some traveling around, meeting with the managers and convincing them that this was a good idea. And then as they've let staff go for a month, and the managers have to work with that, the managers resolve that themselves. We've seen that the same managers will let volunteers come over and over again. They'll let sometimes the same person come, or they'll encourage other staff to come as they've seen the impact on their staff. So it took some convincing in the beginning, but it's gained momentum. Mm-hmm. The second part of the question was about baseline assessments, and unfortunately we have not been great at doing that, so we're excited that Marina is spending a little bit of time now doing a qualitative assessment of how this has impacted the staff.
Thank you,
And
Natalia.
Andy here, I'd like to make one more sort of brief comment on that. And in terms of Abbott support, from the beginning of our program, particularly around 1999 or 2000, Abbott's CEO traveled to Tanzania and saw firsthand the work that we were starting. And senior managers at Abbott have since then been really supportive. So we've had, for example, in the early days, the head of all construction of all and maintenance of all buildings for Abbott. So in 100, responsible for 150 countries. This man would come regularly and also send his staff to stay in Tanzania. And then we draw our technical type representatives that work in laboratories from businesses that directly support customers in running labs, but also from the manufacturing organization because they have laboratories that they use to build our products. And again, in that area, we've had several senior managers that have been really, really supportive. And we engage human resources people for making sure, first of all, that the people have the time away from their job, and also the management support. We also actually have a lot of support from Abbott's security organization, because we want to make sure when our employees are traveling, particularly in Tanzania, that they're safe, that we have good access to medical care, and that we're aware of any security challenges that might be faced. I hope that helps.
Thank you, of course. Thank you, Andrew. And I need to acknowledge the presence of Susana Barneche, which is the national representative for AYAVE in Mexico. Hi, Susana, ¿cómo te va? She's saying, congratulations to all members of this great effort bringing health to the Tanzanians. In fact, nice to see you here. So, Undral, you are with your hands up. I'll open. Yes, how are you?
I'm fine. Do you
Undral?
hear me?
Yes, we can
Yes.
hear you. Yes.
Hi. My name is Undral, and actually I'm female, not him.
I'm so sorry.
It doesn't matter. It's normal. And I'm from Mongolia.
Oh, okay. Welcome.
And I'm the national representative for AYAVE Mongolia.
Oh, so we have met in Mexico. I remember you. Yes.
Yes.
Exactly.
Yeah. Yes, I'm very delighted. It's my first webinar and very delighted about that. I have, of course, thousands, millions of questions, but because due to the short time, I just wondered, because we have our volunteer program, volunteer health, preparing the health volunteers. So actually to date we have 160 health volunteers prepared, trained, and they're working already around in the communities. It doesn't matter. But my question is, the latest problem in the schools is the big sick of children of school age in teeth sickness. Oh, I don't know, maybe my English is bad. And what are the most efficient or effective ways of preventing and treating the teeth sickness of children?
Thank you, Undral. Can we take this question?
Natalia?
Thanks, Andy. Hi, Undral. Thank you for your questions. They're really great. Unfortunately, this one, I don't think we're qualified to respond. We don't work specifically with the illnesses in the children. We support a couple of programs that work with kids on nutrition, but not specifically on teeth. So I'll take your email and I'll see if I can find someone in Tanzania who has some ideas of what they're doing here.
Thank you, Natalia. And at the same time, if everyone here in the audience can share something about teeth buccal health for children, you can write to us and we are going to forward to UNRWA. And Galina from Russia, which was one of former member of the boards of Ayave. How are you, Galina? I miss you. Is saying hi to Andral. It's very nice hear from you. But she's also saying to Abbott people, your presentations is very excellent examples on how you work for the SDGs. Thank you very much. And thank you, Monica and Ayave, for great moderating. And thank you, Galina. Okay, so I will invite Andrew, Natalia, Marina, and John if you want to make some final remarks. We are near the hour of completion of our webinar, and then we can close.
I'll just make a very, very brief remark that for me, Undral, I'm the same as you. This is my first webinar, and to be able to communicate this much information with people all over the world at the same time, I think is just fantastic, and I really appreciate the opportunity. And also, thank you for this great organization. I look forward to learning more about what you all do. And again, thank you.
Thank you so much. Marina, Natalia, John.
Yeah, thank you very much. I would like to really say something. First of all, thank you for giving me this opportunity to be able to talk to the world. And as you recall from my background, I've been working in the labs for most of my life. I've been in the lab for over 37 years. I've seen the labs in Tanzania, how they were by then, and I've gone through the process on how the labs have been improving. I can clearly see the magnitude of the impact of improvement created or initiated by the mentorship programs. The mentorship programs have been very effective as we have been working, or the services have been provided by experts who are coming from developed world, the labs which are automated with the modern technology, and they are bringing out this knowledge to our country, helping us to improve the laboratories. So I think this is a very good program, and I can say for sure Tanzania will be benefiting from this program.
Great, John. Thank you so much. Anything else from Natalia or Marina?
Yeah, I'd like to say, this is Marina, just, thank you again for the opportunity to present on our experience. And as John had said, to bring the knowledge that we share, that we have, and to bring it to Tanzania and to expand the access and the healthcare in Tanzania has been such an amazing experience. And I think it's important for everyone to recognize within their own organizations how important it is for companies to do these types of projects, to have this type of work, not only for for the employees, but for the people of Tanzania.
Exactly. Marina, anything else?
That was me.
Oh, I'm sorry, Natalia. I'm sorry.
I'll just say thank you for everyone for joining. We really enjoy sharing what we do and enjoy connecting with people all over the world. And feel free to contact us with other questions or suggestions even. Thank you.
Thank you all. You see, yes, you notice we had the people from Mongolia, from Russia, from the west coast of the United States, from Latin America. It was really great. And I give you our our warmer thanks to Andrew, Natalia, John, Marina, to Monica Bomani too, to my colleague Laurie Foster, because of this. And I thank you so much for this extraordinary presentation, very professional, very interesting. And I thank our audience for so interesting questions. So I hope everybody has enjoyed, and we will meet briefly. So thank you so much, everybody, and have a good morning or a good afternoon or night until the next opportunity. Bye-bye.
Bye-bye. Thank you.
Thank you. Thank
Bye,
you
thank you.
all.
Thank you.